Hello and welcome to the Garrison Outlook on Location. I'm Randy Jackson from the Public Affairs Office. Today we're here at the Vicenza Army Health Center and I have a special guest to tell us about a very important program that is going to affect the entire community. And ma'am, can you introduce yourself?
Hi Randy, thank you. Lieutenant Colonel Michelle Curley. I'm the clinic commander here in the Vicenza Army Health Center. And I'm excited to be here to talk to you about MHS Genesis. This is DoD's new electronic health record. It is revolutionary. It's being deployed across DoD starting in 2017, and we are now adopting it here in Europe in 2023. What this essentially is going to do is take multiple legacy health record systems and roll it into one for one seamless health record from entry into the Army and then through veteran care as the VA adopts it. What this also means is it's a one place for our patients to view all medical results and reports as well as patient education.
Wow. What does this big change mean for the clinic?
It is a big change, Randy. Essentially overnight, we are going to flip the switch and change our hardware, software, and medical processes. It is a heroic undertaking. It's essentially going overnight from a rotary phone to a smartphone.
That is going to be a big change. I remember when that happened, actually. So can you tell me, how's this going to affect patient care? That's what a lot of people are going to care about, right?
Yeah, understandably. Yeah, there's definitely going to be some impacts to patient care. So we are training and preparing aggressively here. For months we've been training, but there's nothing like the real thing. So as we adopt this new system, there's going to be some growing pains as our providers learn the system and we identify and resolve any issues with those three components: hardware, software, and business processes. With that, we expect to see a significant but temporary reduction in access to care and prolonged wait times. With that, the additional impact is going to be, because we have that limited access, is we'll really be focusing in priority care to acute and time-sensitive care needed for our prime enrollees.
Okay. So yeah, you'll be basically making sure that you take care of people as much as possible beforehand, right? Is that going to affect how patients get care? Is that what's happening next? What impact it'll have on them?
I guess I would frame it as this: there's lots that we can do as a community to minimize that impact, and a lot of that is with our patients partnering with us. So top 4 things recommend for our patients to do before September 22nd is ensure you make and complete all of your routine, wellness, and chronic condition appointments. Example being, if you have a typical annual exam that would expire before December, you'd want to do that now. If you have a chronic condition like diabetes or hypertension that you'd want to address before December, do that now. And that will help us with our limited access so we can focus on the more acute, time-sensitive once we are in a limited access of care space. A second piece that our patients can do, especially our soldiers, is make sure you complete any individual medical readiness that is due through December. A third place that our patients can really help get ahead of this is refilling any routine pharmaceuticals before September 22nd as well. And then lastly, our patients are going to have to get prepared for this new MHS Genesis portal by first ensuring their DEERS is correct, and then secondly, establishing a DS login if they don't already have one.
Well, I have to make sure that I get my prescriptions renewed. I know that will affect me. How is the clinic getting ready to help the community for this? I saw some of the training that you guys were doing last week. Very studiously, learning some of the new terms and things like that. So how is it going?
Yeah, it's going good. We're training hard. In addition to training and preparing ourselves, is making sure that we maximize what services we can provide for the community. So you mentioned pharmaceuticals. For those routine pharmaceuticals, when you renew them, we are going to issue 90-day refills, and that will take you through that limited access period. A second piece is really providing a robust guide on all things MHS Genesis. So you'll start seeing that around the community. It'll give you all of the tips that I just described here, as well as additional resources. Third, we're maximizing our access now. So come in and book your appointments. I know you'll talk about that at the end of here. And then fourth and foremost, effective 6th September, we are synchronizing all of our medical readiness services across the clinic to be available for walk-in on Monday afternoons and Wednesday mornings. Additionally, effective September 6th is we'll have established an MHS Genesis help desk to help desk side with a computer, our patients create a DS login as well as enroll in the MHS Genesis portal.
Well, it's a lot of things, but it sounds like you have a good plan to manage it. Is there anything else you'd like to add about MHS Genesis?
It's an exciting time. It's going to be a challenging time, and we're really excited to partner with the community through this monumental change for the better of us all.
Well, okay. Well, we look forward to it. I think it will make streamline things a little bit better for the community. If you have any other questions, or you want to, you missed some part of it, feel free to re-watch the video again, or make sure you visit us at the Garrison Outlook. You can just type that into your browser of choice, TGO, the Garrison Outlook, on location. Thanks again, and see you next time.